The biggest crime we can commit is to telling these fibromyalgia patients that it is all in your head. When it comes to fibromyalgia, that alarm that is inside your body has become extremely sensitive. In a fibromyalgia patient, the volume knob for pain is turned high. Now, they are the ones who could not say no. Like, they are so responsible, the strong ones, the one who manages everything and troubles nobody. After years of this, it's almost as if the body steps in and says, okay, if you are struggling to say no, don't worry, I will step in and help you to say that. If someone has fibromyalgia, one of the most painful things they may have heard is not about the pain itself. It is these words that they hear commonly, which is your reports are normal, or your scan is quite clean, or your blood work is absolutely fine. And then gently or not so gently, maybe it's stress, or maybe it's in your head, or is everything okay at home? Now, this person is carrying two pains instead of one. So the first pain is from the body, and that pain is real. And the second pain is that nobody can see that they are in pain. And that loneliness of not being seen that they are in pain sometimes makes the real pain even worse. Now, let me say this clearly. See, I don't think fibromyalgia patients are imagining this pain, and I don't think they are a weak or lazy or dramatic personality. Now, honestly, in my opinion, fibromyalgia patients are some of the strongest people I have come across in my years of practice. Now, they are the people who have carried impossible things for years without complaining, without saying no, without troubling anyone. Because this pain is so invisible, it's like tiring, unpredictable, and often invisible on a scan. And it makes strong people look like they are not trying anymore. And that is the most unfair thing I see in our current healthcare. Now, I must also confess something myself. Like, early in my career, when somebody kept showing signs of pain with fibromyalgia, but the report showing nothing, a part of me also judged them. Like, I did not understand the depth of it. So sometimes a family would come along and say, doctor, whenever something happens that he or she doesn't like, and suddenly the pain comes. Or if we say something against him or her, suddenly they shut down with pain. So in the beginning, I did not understand, maybe is that like an escape mechanism? But after seeing more and more of these patients, something changed in me, because there is a limit how long a person can actually fake an act. And slowly I started thinking, my goodness, how are they actually holding this much of pain? Now, the biggest crime we can commit is to telling these fibromyalgia patients that it is all in your head, because it is not. Now, one way I understand fibromyalgia is this. It's like, you're driving a car uphill with the handbrake on. Now, the car is moving up, but everything takes more effort. The engine starts straining, and from the outside, the road looks normal, but inside, the whole system is under strain and it just heats up. Now, that's what a normal day can feel like. A normal conversation can feel very heavy for them. A normal amount of work can make the body crash very quickly. And they sleep tired, wake up tired. There's a brain fog. They tend to forget small things. And they feel low, like very irritable. And then they feel guilty of being irritable. And somewhere in all of this, even they start asking, am I just making this up? And that's the trap that they fall into, because they are not. See, what we understand today is that fibromyalgia is not an imaginary condition. It's actually a misunderstood situation. See, all of our body, we all have something called an alarm system. And pain is one of these alarms. So if there is fire, the alarm should ring. And if there is any burglary, the alarm should ring. Let's say you have an alarm system in your home. Now, that alarm is kept for a protection. But when it comes to fibromyalgia, that alarm that is inside your body has become extremely sensitive. It's like, your home alarm starts ringing when a cat walks past the door, or when wind moves and a leaf touches the window. And that alarm is not fake. Actually, that alarm is working, but it's just that it is ringing for things that are not dangerous and which is actually normal and very safe to do. So that is what is happening here. Now, we have a medical term for this, and this is called as the central sensitization. Now, the word central, we have the central nervous system, like the brain and the spinal cord. And the word sensitization, it means it's very sensitive. So in this situation, the volume knob of the pain, like you have the volume knob for increasing the volume of a sound system. In a fibromyalgia patient, the volume knob for pain is turned high. So the problem isn't always where the pain is felt. It's also how the nervous system is processing the signal. It's like, the pain is playing at 4K even when the original signal started in 720p, like in your camera. So that's why one person can do a light workout and feel a normal soreness, but a fibromyalgia patient can do the same thing and be in pain for more than 3 or 4 days. Now, this is not weakness, the threshold has changed. Then sleep enters the picture, and this is very important. See, poor sleep is not a side issue in fibromyalgia, it's one of the most core problems. See, poor sleep increases pain, and then pain disturbs sleep, and then fatigue rises, mood drops, and the nervous system gets more sensitive, and then the pain increases again. Like in Kerala, we have a saying, catching the tiger's tail. You can't let go because the tiger may turn and bite, and if you hold on, you have to keep running. Now that's the sleep and pain loop that happens in a fibromyalgia patient, and then the person is stuck holding to the tiger's tail. And by the time most people get the diagnosis, they have already been on a long journey. Like they could have started with a general physician, then they could refer to orthopedic, and then to a rheumatologist, then to a neurologist, and then most probably a psychiatrist, or then to a physiotherapist either. And then the scans, the supplements, the painkillers, and then advice from everybody around them. Like just reduce your stress and think positive and just don't think too much. And by then the patient is quite exhausted, not only from the pain but from the noise. Because most of that advice came without anyone really understanding what was happening inside them. Now this is why fibromyalgia needs little more understanding than just the scientific understanding. See, it needs the art of listening to a human being with emotions and a soul. Now let me try to explain this a little more carefully. Now, do I think suppressed emotion causes fibromyalgia? No, I can't say that because research does not say that. And trauma does not cause fibromyalgia in every person either. Like depression does not mean the pain is fake. Anxiety does not mean it's only in the mind. But I can share this as my clinical observation close to last 2 decades, seeing multiple hundreds of fibromyalgia patients. So many of these patients I've seen share one common pattern. Now they are the ones who could not say no. Like they are so responsible, the strong ones, the one who manages everything and troubles nobody, the one who says it's okay when it is not actually okay. See, the one who says yes when every cell in their body is saying no. Because they want to keep the peace, because they want to avoid that conflict, because they can't bear the disappointment that they see in others anymore. And after years of this, it's almost as if the body steps in and says, okay, if you are struggling to say no, then don't worry, I will step in and help you to say that. And the way the body says no is from pain or fatigue or a flare-up or a sleepless night, and just the body refuses to just move. No, this is not blame, and this is also not trying to say that you did this to yourself. It's the opposite. They held on too long for everyone else, and somewhere the body started paying the price. So when I look at fibromyalgia through an Ayurvedic lens, it's very clear, not as a replacement for diagnosis. It's a way of understanding the person much better. See, in Ayurveda, the concept, the Vata, it governs the movement, sensitivity, creativity, fear, restlessness, and even pain. So you could say Vata is the intelligence that runs the movement and communication in the body, and it's deeply tied to the nervous system. So when Vata is disturbed for a long period, you exactly see this picture. The pain that moves around, the broken sleep, irregular digestion, anxious mind, too much of bloating after you eat, a body that becomes sensitive to sound, light, weather, food, touch, and even people. They have social anxiety because everything feels just too much. And Vata doesn't get corrected with a prescription from a pharmacy alone. It needs many things like routine, warmth, rest, stability, that quietness, that connection with nature, and a place where you feel safe. See, a place where the person doesn't feel constantly under threat. Basically, the opposite of everything that pulled them away from real life. And then there is Agni, the digestion, the metabolic fire. Now, many of these patients have a gut that's become unreliable. Like soon after they eat, they feel bloated. The bloating can trigger pain into the shoulder, neck, head, or back, or whole upper part of the body. And then suddenly it changes and the body feels heavy. See, Ayurveda is not just about asking, are you digesting your food? It's also to ask a little more deeper, like, are you really digesting your life? Can this person digest conflict, disappointment, living in a way that doesn't suit them, being needed but not cared for? See, when that doesn't happen, Ayurveda calls the residue as ama. See, I don't want to loosely translate ama as inflammation. It is not justice to it. A very possible translation of the word ama, it is like unprocessed residue, like something that you're supposed to process, you're not able to process, and there's a lot of leftovers. Something that was not properly digested or cleared, and it leads to a lot of heaviness and blockedness. See, it's like a feeling of carrying something. And many patients, when they come and say, even though they don't understand the concept of pharma, they come and say, Doctor, I feel so heavy in the morning. I struggle to wake up. At night, I struggle to sleep. I feel so bloated, and I feel like I'm carrying something so heavy with me. See, none of this replaces a proper medical workup. Now, please don't label everybody's pain as it is fibromyalgia. First, we have to rule out multiple other things, like we have to rule out thyroid issues or autoimmune conditions, or maybe B12 or vitamin D deficiencies, anemia. Like there are so many other things if they're under any certain medications, hormonal shifts, sleep apnea. A lot of this we need to rule out in the first place. And one thing I keep seeing clinically, perimenopause and fibromyalgia has a tendency to overlap. In my early years, most of the fibromyalgia patients that I came across were actually women in their early and mid 40s. Now, later, I also started seeing younger patients and men too. But overall, it shows up more in women than men. Maybe we need to research why that is happening. And also, during the perimenopause, when hormones are shifting and the person is already exhausted, this sensitivity can become much more visible. So that overlap needs a little more attention. So if it is fibromyalgia, what does help? See, some of the patients, they already get prescribed with their allopathic doctors, like they take gabapentin or pregabalin or duloxetine. Sometimes this helps with sleep and pain. For some, the benefits are fantastic. It's like they are coming back to life. But for others, they say that after taking this, the benefits are very marginal, and even some struggle with side effects, like with heaviness or lethargy, or they put on weight and feeling emotionally dull. They feel very heavy in nature. So it's very individual, not a guarantee. And then I also see patients who started taking up cognitive behavioral therapy. See, in Ayurveda, we have this statement, whenever a person is going through an emotional problem, there's this thing called Di Dhairyam Atma Di Vijnanam. It's like give them clarity, give them courage, and give them understanding of their self beyond their body and their knowledge of the soul. See, modern psychology uses different words, but the work is quite similar. And then there is movement. Gentle aerobic movement helps, gentle strength training helps, breath-led stretching like pranayama helps. But again, here the dose is everything. The moment you push too hard, the body will crash. Do nothing and the body gets weaker. The goal isn't to prove that, they are like an athlete. The goal is to rebuild trust with the body that they have been at war with. Because most of the fibromyalgia patients live in two modes. Like either they only know how to overdo things or they know how to collapse. So overdo or collapse. So what they have to learn is when they are doing, the moment they know that they are going to get exhausted, take a step back, pause, recover, and then do pause, recover. So this is what they need to relearn. But somehow they just miss that bus, overdoing and collapsing. That is how that cycle just keeps happening. So somehow they need to learn to rest before crashing. Now coming to that question, can Panchakarma help? People ask me about this constantly. So my answer is, if anyone tells you Panchakarma is a guaranteed cure for fibromyalgia, please don't believe them. I have personally seen mixed results, but I have also seen where it helps beautifully and where it does not help. See, it is not an emergency care, it is not a replacement for diagnosis. Nobody does Panchakarma for 2 or 3 weeks and walks back completely cured from fibromyalgia. But when they do it properly, it gives many of these patients something they have never been allowed. A real pause in their life. It's not like a holiday or a spa day. Now, here's what I have noticed where Panchakarma does not help. Now, let's say someone comes for an Ayurvedic retreat, but they are still, along with the treatments, they take the work calls, doing meetings, online meetings, carrying the same stress. Doctor, I have fibromyalgia, but I also have these calls. Somehow you have to treat me. Now, in these patients, we always get very minimal result, and sometimes the results are very poor. And because there is a limit to what any treatment can do while the nervous system is still under the same stimulation that created the stress. But when someone comes and says, Doctor, I am suffering, I don't know what to do, please just see what can be done, and I am ready to do everything as you say. There something shifts. The environment changes, the triggers fall away. For once, they are not making every decision for everyone. For once, someone is looking after them. See, in Ayurveda, there is this thing. When Vata and Pitta are very high, one of the protocol is that person should be surrounded by people who care for them, and they should be surrounded in a pleasant nature where they feel safe. That itself is medicine. So, when a person comes to an Ayurvedic retreat, the environment that kept setting off the alarm is reduced. A rhythm comes in, a routine comes in, the food on time, sleep on time, therapies that will calm their body like Abhyangam, Dara, Shirodhara, the warm oil that is used to calm them, the Potli therapies when suitable, the oil retention therapies like Nabi Vasti or Uro Vasti when needed. And we do a lot of Yoga Nidra for these patients. Yoga Nidra, it's like those therapies where we put them on an auto suggestion to calm that entire body. And then Pranayama, definitely they have to be on less on screen time, less on stimulation, and maybe doing a gentle reading, a lot of journaling, sitting in nature, even embracing a little bit of boredom. For many of these patients, that itself becomes the real therapy. Now, I also have seen patients who wear these smart ring trackers, and they tell me that their heart rate variability improved over their 2 to 3 weeks of Panchakarma. But I won't pretend one therapy did it. It's the whole thing. It's like the sleep, the routine, the food, rest, being cared for, a mind without a constant to-do list in the background. See, that feeling of finishing your exams and having nothing pending for the few days, like you're going for an examination. That taste of freedom, that's what actually they really need. And that's what helps that nervous system to calm down and recalibrate. And during this time, when they go through that relaxation period, that is when something powerful often happens. Like there is an aha moment. Like after 8 or 10 days, sometimes 2 weeks, they suddenly start seeing that patterns. They realize they had normalized pain for a lot of years. And for some, it wasn't even low grade, it was high grade pain that they have simply learned to carry forward. And they start seeing it like my flare-ups come after I speak to this particular person. This work environment is draining me. Or certain people at their home. It could be their partner. I had a patient who says that their biggest stressor was the maid at home. Someone she felt was manipulative and constantly complaining. But out of guilt and out of sense of duty, she couldn't let her go, and she slowly realized she was paying for it with her own health, which is pain. So when you go deeper, it's fascinating how much stress people absorb without ever learning how to process it. Now that's where the aha moment comes and gives them that wake-up call. And that's when something important turns inside. They realize that their body is not actually their enemy. And that is when the healing begins. Not because everything is cured, but because that relationship with the body changes. See, most fibromyalgia patients are always at war with their body. They hate the pain and they fear that fatigue. They push through, they collapse, they feel guilty, and then they push again. So a good Panchakarma gives them the space to step out of that loop, to start eating before the acidity comes, or to sleep before the exhaustion creeps in, to stop before the flare-up, to say no before the resentment builds, and which means to say without any guilt. See, in Ayurveda, emotion and the body are not separate. But at the same time, we should not romanticize it or moralize it either. See, not every pain is a hidden emotion, but many pains do get worse when emotions are constantly suppressed. Like, for example, anger or grief or fear, resentment, or what I call learned helplessness. See, the pain of being unseen, the pain of being needed but not cared for, that pain of being strong for too long, these are the pains that accumulates and makes things worse. Most of these patients don't need someone to tell them just be positive. They actually need someone to ask these questions like, what have you been carrying? What are you unable to say? And where in your life do you feel unsafe? Like, what part of you is exhausted from pretending or being somebody else that you're not? Now, these are not some philosophical questions. They are actually very critical clinical questions, because the nervous system listens to life. And if the life keeps telling the body, stay alert, no medicine alone can convince it to relax. So what should someone with fibromyalgia actually do? Now, here are my answers. The first, let's get a proper evaluation, because here the evaluation is ruling out the other causes first, and don't self-diagnose. Second, protect sleep like your life depends on it, because here it almost does. Early dinner, less screen time at night, a warm bath if it suits them, a calm wind down. It can sound very boring, but it really works. Somehow redesign your life in such a way that you can prioritize your early sleep. Now, the third thing, eat with routine, like warm, cooked, simple food at regular times suits a disturbed Vata far better than cold food or skipped meal or random fasting or junk food. Now, fourth, keep a trigger journal. Not only like what you ate, and also about what happened. Did they impact your sleep? Did you overcome it during this day? Or what did you learn? What are you grateful for? Just start documenting about your emotions and your headspace, including what you eat and what all you did, what drained you, what energized you, and start seeing how this is impacting your overall energy levels. The fifth one, don't punish the body with too much exercise. Take it slow, like walk gently, stretch little, move with the breath, and slowly find that sweet spot where you're not over exercising and at the same time you're not sedentary. Now, sixth one, get good psychological support if needed. Not because the pain is fake, because living with chronic pain is genuinely not an easy task, and you really deserve to be heard and to be understood that there is something going on with you, and that makes a big difference. And seventh one, if it feels right, consider a proper Ayurvedic retreat, because that will give you a proper reset, but not with the idea that the doctor will fix me while I do nothing and I just sign up for this retreat. It has to be a collaboration. This work the patient also has to do, like slowing down is work, resting without guilt is work, watching your own patterns honestly is also the work that you need to do. So the body is not betraying the patient. I know it can feel like the enemy, but it may be protecting them in the only language it has left, that is pain or fatigue or sensitivity or shutting down. And it's not screaming to punish them, it's screaming because for years nobody listened when it was whispering. So here's what I want a fibromyalgia patient to walk away with. The pain is real. Normal reports does not mean the pain is imaginary in nature. It just means that we have to listen to the nervous system more carefully than a blood test report. And if they have spent years being doubted and dismissed, they need to hear this clearly. They are not weak, they are not exaggerating, and they are not alone, and they have been carrying something heavy for a long time, mostly by themselves, and they do not have to keep carrying it exactly like that. If this conversation feels a little too personal, like it's describing how your situation is or your medical condition, then maybe the body has been asking for something deeper than another quick fix. Maybe it's time to consider a proper reset, a place to step away from the environment that keeps the alarm ringing. Usually a 2 or 3 week pause, not as a holy grail, not as a like a magic bullet. It's just as a beginning, a jump start, an invitation to stop running uphill with that handbrake on, and to be looked after for a while instead of always being the one who looks after everyone else. And whether someone chooses an Ayurvedic retreat or not, please, this year do one thing for the body that has been holding you up all this time, and just try listening to it. This conversation is for your awareness. It is not a substitute for a medical diagnosis or a treatment. See, fibromyalgia is proper evaluation, especially to rule out other causes of pain and fatigue. If this helped you, please do share this with someone who might need it. Thank you.